Hey everyone, it is Monday night, back for my weekly session to inform you guys about some current topics and what's going on and things that you need to know in order to make the best decisions about your healthcare. So today's a big one. It's one I'm really passionate about, and I get questions all the time over this topic. So this topic is back pain, and it just so many people are affected by back pain. And what kind of is very interesting about it is that it affects so many people, and so many people have different answers as to what can help them and what seems to work for them. But just because it works for them doesn't mean it's going to work for you. Thanks so much for the like, Aunt Katie. So it's just a very interesting topic, and there's so much garbage information out there that you really need to be aware of it to protect yourself and to make the best informed decision about your healthcare. So I can't preach about this enough. So we're going to be going over, I don't know if I'm going to like wipe the camera real quick. I don't know if there's my end looks a little kind of grainy. So if you can see me well, if you can't see me well or hear me well, let me know. But what we're going to be going over are the 3 myths. There's way more than 3 myths out there, but 3 myths is what I have time for tonight about back pain. And these are honestly tidbits of information that could save you or someone you know from surgery. So, you're talking about some serious stuff right there in terms of saving both time, money, heartache, just emotional stress when it comes to surgery. So 3 myths about back pain that you really need to know and that everyone should know. Everyone should be aware of these myths out there. So the first myth, is that as far as imaging, so imaging being an MRI, CT scan, X-ray, do you need it to diagnose back pain and to see what is going on and to solve the problem? So a lot of people buy into what we call a biomechanical model, where you need to see what is going on in the body in order to diagnose, but what they've really found is that that's just not true. So while imaging is great and has come a long way, and you can see with an MRI a lot of detail and everything like that inside the body, it's also become kind of dangerous because the biomechanical model is not always correct. So they have done studies out there. So research studies have shown that there is no relationship between pain and imaging. So just because something comes up on an MRI, a CT scan, an X-ray, does not mean that that is the source of pain. So they took people, off the streets, people without symptoms, and did imaging on them, X-ray, MRI, and they found that there were abnormalities, bulging discs, degenerative disc disease, arthritis, all these things that should potentially cause pain, and these people are pain-free. So why is that? Why do they not have pain, but then you go in and you have a bulging disc and you have pain? Well, there's a lot that goes into it, and really what your body perceives as threatening is really what can cause pain. And there can be central sensitization, and there can be all these things that factor into you having pain and perceiving pain and what your body perceives as threatening. And you might say, well, is it all in my head? And no, it's not all in your head. Pain is very complex, especially back pain. It can be extremely complex in terms of stress can play a role, past experiences, emotion, all of these things can play a role in how we perceive pain. So that's the number one thing, is imaging is not necessary in order to diagnose back pain. And I really strongly recommend that you don't get imaging first, because then you can manifest on that and just think, well, imaging showed I have a bulging disc. I have a bulging disc. Like, how is this going to get better? How is anything else going to help me? Well, just because you have a bulging disc, I mean, so does probably Joe down the street, and he doesn't have any pain, but you do. So taking that into consideration, that's a huge one right there. So I try to tell people not to rely on that. So the next one is pain equals tissue damage. So this kind of piggybacks on the whole imaging thing. Pain does not equal tissue damage necessarily. So with tissue healing, and if there is tissue damage to the body within typically like 6 to 12 week time frame, especially within like 3 months, if you did have damage, that damage is likely the body heals itself, okay? And so just because you have pain does not mean that you have tissue, that there is damage and that there's something wrong. So again, it can lead back to what the brain and what your body perceives as threatening can be a much bigger factor. So reconceptualizing, understanding what pain is and where it comes from plays a very large role in how you can deal with pain. They've done studies that show that simply just educating people on what pain is and how to control their pain, how to manage their pain, can resolve symptoms by up to 30%. Simply just talking to them and educating them on what pain is, without laying any hands on them, doing any exercises, anything like that. Simply just educating a person can reduce their pain, because their pain likely is related to stress and some other things. So that's a huge one. Pain does not always equal tissue damage. So, and when I say tissue damage, again, I'm talking bulging disc, a tear, a rupture, whatever, being out of alignment. So that gets thrown out there a lot. Oh, I'm out of alignment. My body's out of whack. And when you think of that, like in your head, you just think of a train wreck. Like your spine just looks like an absolute train wreck when someone says like, oh, you're out of alignment. Well, it's scary. It's, threatening. And those are just kind of really, to me, those are fear factors to get you to buy into someone's services. They should be able to show you why you should be hopeful about their services and not try to use scare tactics to get you to buy in. So I when someone says, oh, I'm out of alignment, my hips are out of whack, my back's out of whack, my back's a mess, I really just try to talk them down from that ledge and educate them on what's going on. So, and if you have any questions, please drop them in the comments below. I'm more than happy to answer them for you. And so the last thing for the myths that I've listed here today is that you need surgery to fix your back pain. So there's some really good books out there if you want to look into whether surgery is necessary. One of them is called Crooked, and I bought this book. I read it. It was actually written by a journalist, an investigative journalist who was dealing with chronic back pain, and she tried like everything. She tried physical therapy, chiropractors, acupuncture. She had surgery, you name it. Like, she was kind of going through it. And so she essentially wrote this piece as how she does her investigative journalism, and really uncovered a lot of what can contribute to back pain and what some of the best approaches are. And she really hits on surgery because she had surgery, and talks about her own experiences and kind of what, these TV infomercials portray as like, oh, like you wake up and you feel good and your back is fixed after you have this lumbar fusion. Well, guess what? I mean, if you have surgery and you have, for example, a fusion of your spine, sometimes it is necessary, sometimes, but more often than not, it's not necessary, and it should not be your go-to by any means. So if you fix, here's your spine, and you essentially fixate two of your vertebrae together, well, you got to get that movement from somewhere and compensate for it, because now those aren't moving, and they've just, the studies out there show, and you can look these up, the studies show that back surgery is no better than physical therapy for your back. So to me, that's huge. So why would you go under the knife and risk something if you haven't tried conservative measures first? You should absolutely try conservative measures first. Try and see multiple people before you undergo back surgery that's not necessarily going to guarantee to fix any of your pain. And sometimes you're even worse coming out of it, unfortunately. So I really feel for those individuals, and it's awful, and they're miserable, and they're frustrated, and I completely understand. I don't wish that on anyone. So really exhaust your conservative measures before considering surgery, and really make sure you're getting that second opinion too. I can't preach that enough. So those are the 3 myths that I'm going to preach on today. There's so many more out there, but those are the 3 I'm going to touch on today. Are you need imaging such as an MRI, CT scan, or X-ray to determine what is going on with your back and to solve your back pain, solve that mystery of what's causing it. That's not true. Pain equals tissue damage. Pain does not equal tissue damage. That is not necessarily the case, and they've shown that in different studies. And you need surgery to fix your back pain. Absolutely not true. And also has been shown in multiple research articles that back surgery and lumbar fusions are have no greater effect than physical therapy, and sometimes can cause more harm than good. So make sure you do your research. If you have any questions, please comment in the comments below. I'm more than happy to come back and answer them for you. If you found this beneficial, please give it a like, give it a love or a heart or whatever. Share it with your friends, just so that way if they're dealing with any back issues, maybe this helps solve some questions for them, and maybe you save them from an unnecessary surgery. So I can't say that enough in terms of saving you from unnecessary surgery that costs thousands of dollars, costs time to recover from, and just the emotional stress and trauma that is incurred with it too is pretty high. So sometimes it is necessary, and sometimes it will help, but they just find that more often than not, you really, really, really need to be cautious when if you're considering that at all. So thanks so much for watching and hanging out with me here on Monday night. You guys enjoy the rest of your Monday. Have a great week. You have 4 more days to kill it and get things done. So I hope you guys have a great week. Thanks so much for watching. See you later.